My name is Sourima, and I'm clinical application specialist at CooperSurgical. But of course, I'm a clinical embryologist, and I'm sure you have heard a lot of talks about, embryo culture media, selection, and also obviously the sperm side of things, and definitely the clinical side with respect to treatment pathways for several categories of patients. So today, my talk, we will be looking at media supplemented with GM-CSF, which is granulocyte macrophage colony stimulating factor, and how we can use this supplemented media specifically for poor prognosis patients. So before we actually, talk about GM-CSF, of course, I'd like to kind of define what we mean by poor prognosis patients. Surely most of you already know these categories of patients. And then we'll talk about the embryo-endometrial crosstalk. We will then look at why this crosstalk is so important and what are the factors that interplay in this communication. And then we'll look at the clinical studies that are being there for a while. And then we'll just summarize. That's it, Holly. So poor prognosis patients, most of us are very aware of. We have repeated implantation failure, recurrent miscarriage, and amongst others, the most common one is advanced maternal age. There could be patients with underlying genetic conditions or predisposed to other phenotypic conditions as well, and other iatrogenic, or in other words, that if they have any underlying disorders for which they are taking different medications, which then have an effect on their fertility. So in terms of how to kind of help these group of patients, as you all know, for the last, in the last 5 decades, the first sort of 4 decades, I think, within embryology, we have concentrated or focused more on how the embryo develops in vitro, how we can better that, how we can better select the embryos, and which embryo is really the embryo that will give you a live birth. But when we look at the bigger picture, and as we all know, the rate of implantation and live birth, at least within the UK, is still quite stagnated at around 33 overall. So what is it that we are missing out? So of course, we definitely missed out looking at the other half of the story, which is the endometrium, because even if we select the best quality of embryo, it will only stick if the endometrium is expressing the right kind of proteins or receptors that it's able to receive the embryo. So here, this slide kind of very much simplifies the different interaction that goes on between the embryo at the pre-implantation stages. Now, this for us happens in the IVF lab up to day 5, 6, or 7. And then you have the other half of this image where you can see that the time when you transfer the embryo on day 5, 6, or 7, you have the embryo which has to communicate with the epithelial cells of the endometrium for it to then oppose and adhere to the endometrium and finally invade it. And once it has invaded it, or i.e. implantation has taken place, it then needs to communicate with the tissue architecture within the decidua of the endometrium. And so there are several factors that are key in this process. And as you can imagine, the embryo is a semi-allergen. So really, how is the endometrium going to receive it? It might treat it as an alien. So it's a very immunologically charged environment out there. So, of course, it's not surprising, therefore, that cytokines and growth factors are involved in this. And there's a whole list of factors. This is just very few. There's hundreds of factors that come into play. But amongst these, you can see most of them are growth factors, or you can see, for example, the brain-derived neurotropic factor, which is directly connected or moderates neurotransmitters, which we know plays a role in moderating the pituitary hypothalamus axis. And then we have obviously GM-CSF, Again, it's a colony stimulating factor for your granulocyte and macrophage, and that's important because, as we know, macrophages, eat away the tissue that's left over towards the end of the cycle. And again, immunologically, all of this comes to play during the time of implantation. So we know that the womb expresses, or the endometrium expresses these different factors. But what is really important is that the human embryo also expresses the receptors to these factors. So that tells us from the science itself that there has to be a communication between these two, because both of them express the same set of protein receptor. There has to be a reason. And so, of course, these are immunofluorescence images of the similar growth factors and cytokines that I showed you earlier on in the endometrium. And really, the important thing to take away is the level of communication that goes on between the embryo and the endometrium. So there's a lot of growth factors, but why is GM-CSF our hero today? Because the unique thing with GM-CSF is that it's present all over our body. It's not just the endometrium. It's a key factor in several tissue architecture. But within the reproductive system itself, we know that the expression of GM-CSF, which is super dynamic, as is our endometrium, goes to peaks and troughs. Its expression increases drastically during pregnancy. And we also know from a study, 2003, so about 20 years ago, that when they looked at the level of GM-CSF expression between women who have gotten pregnant and given birth naturally versus women who have had miscarriage, and they showed that the level of expression of GM-CSF is actually barely there for women who have had recurrent miscarriage. So that gives us a kind of indication that it's present as a very specific point, so there must be some correlation. We also know that GM-CSF directly affects the growth of the endometrial cells, and this is not surprising because it has several network of communication within the different molecules that are surrounding it in very specific environments, such as the endometrium and also the expression within the womb. And then finally, we know that the upregulation of GM-CSF during the pregnancy. So let's suppose that the embryo has implanted, but the embryo will go on to fully form a baby, and the live birth will happen only if it is sustained through the 9 months. And for that, coming back to the immunological side, there is this amazing interplay of the immune system of the mom, where the helper cells Th1, Th2 balance is what determines whether pregnancy is sustained or not. So, for example, it shifts from Th1 to Th2, and that's T helper cells, 1 to Th2 increase. And that's what regulates pregnancy or sustains pregnancy. And GM-CSF is a key factor in moderating, in different contexts, the amount of Th1 and Th2. So therefore, we know that the upregulation of GM-CSF is essential, as in it needs to be present to look out for the immune cells that allow the pregnancy to be sustained over time.
Right?
Finally, of course, there's a lot of science, but we need data in our specific scenario. So this is the first RCT that was carried out. This is data from 2013, where you can see here that in the group of patients where the embryo was grown in GM-CSF supplemented media, across the chain in terms of clinical outcome, implantation rate 7 weeks, 12 weeks, as well as live birth rate was significantly increased for the embryos which were grown in media supplemented with GM-CSF. So this was the first trial. Then on the basis of that, we realized, okay, there's science. We know that if we supplement a media with this factor, it does have some clinical benefit. So can we actually help others use the same thing? So on the basis of that, there were 3 media that were manufactured, and it's ongoing, and that's the Sage One-Step GM-CSF, which is FDA approved, so it's currently being used in the US. However, fingers crossed, we are going to get the CE marking in the second half of this year. So please keep your eyes and ears all wide open, because of course we mostly use single step media now in culture. So that's coming ASAP. But in the meantime, we also have Embryo-Gen, which is media supplement with GM-CSF up to day 3. And then the Blast-Gen, which is sustained from day 3 to day 5, 6, or 7 prior to transfer or freezing. We have these 3 ready-to-use portfolio of media. And like I said, of course, the Sage One-Step is yet to be CE marked, but it's imminent. And in the meantime, I'll show you some clinical data in terms of the labs that have used them, what they have seen. And some of this data is actually, they're quite old. So this is one of the first ones that came out. And this is, and one thing that I want to mention is most of the studies that are present here, it's for about 200 to 300 embryos, and they're mainly Embryo-Gen media that were tested purely because around 2013, I mean, about 10 years ago or so, people were using doing day 3 transfers. So it makes sense that Embryo-Gen has the most number of studies. So this is one of the first studies, a retrospective observational study, which clearly shows here that the usage of, or the supplementation of GM-CSF in the media to culture embryos have given significantly reduced rate of miscarriages, and therefore consequently have had higher live birth rates. We also know, of course, that our talk today is specifically for poor prognosis patients. So one of the other studies that I want to show or share with you today is this one a year after, where they compared 2 specific media, one of which was Embryo-Gen. And what they showed clearly here, you can see that again across the chain of clinical outcomes, the pregnancy rate, implantation rates are all significantly higher in the group that where the embryo has been cultured in media supplemented with GM-CSF. And one thing to note, that these are in women specifically who have suffered recurrent implantation failure. And that is, the cohort of patients that are really difficult, to consult. Another study, this was a SART data, and again, it's pretty similar in terms of the outcome. The group of patients that they chose were advanced maternal age patients, recurrent miscarriage or recurrent implantation failure, and they saw the same difference. They saw an increased rate of clinical pregnancy and therefore fetal heart rate in these specific group of patients. Moving on, this is a study which is not just with GM-CSF, because as I told you, there are hundreds of other factors that are involved. So people wanted to see, how about we supplement GM-CSF, but also add some other growth factors in there and see if, because they all communicate with each other in normal physiology. And in fact, they obviously saw a positive outcome, which is not necessarily surprising, really, after we had seen the GM-CSF studies early on. And again, across the board, you can see the ongoing pregnancy, the live birth, and the reduction in miscarriage is highlighted, and they were all significantly more in terms of in the group with GM-CSF. And finally, I wanted to share with you this study, which is relatively recent, 2021. And here, not so much as the ideal or the common poor prognosis patients, but patients where they have experienced embryonic arrest. So by day 3, or they get fertilized, this first or 2 or 3 cell divisions happen, but then they arrest. So we don't actually know what to do with them in the lab. In this study is one of the favorite slides actually for me, because this is one study where there was no significant difference, and that's what is significant about it, because they had their control group where they have the normal patients, or I said normal patients, they were the patients in the embryonic arrest, and then they have the group where they treated the embryonic previous patients with previous embryonic arrest, but used GM-CSF supplemented media. And what they in fact saw was that here you can see there's none of these are significantly different in terms of the development of the embryos, day 3, day 5. So the day 3 arrest has been removed. And then the implantation rate, clinical pregnancy rate, miscarriage, and live birth rate were all revived back to comparable to the control group. So in a sense, supplementing your culture media with GM-CSF has been able to help the growth of the embryo post day 3 or sustained growth, and therefore, of course, clinical pregnancy post transfer and live birth rates, which is usually the gold standard comparison, within the IVF field. So those are the topics that I wanted to talk to you about mainly. But essentially, there are a few things that I think are super important when we talk about GM-CSF. It is a molecule that's present all over our body in all tissues and cellular matrices and so on. And it's something that is significantly important when we talk about pregnancy, implantation, and live birth. And that's because of how dynamic this molecule is, and that it's able its expression is very specific, and it peaks and troughs depending on the timing of the cycle. And what is important here also that we have seen that it can help poor prognosis patients, recurrent implantation failure, recurrent miscarriage, and also patients who we have seen don't go beyond day 2 or day 3 to blastocyst stage, that it is able to revive those embryos as well. Of course, we need larger RCTs, especially the SAGE 1-step GM-CSF and Blastgen, purely because these studies were in the initial days where day 3 transfers were common. So hopefully I will see some of you contacting us in the very near future. And we are there to help you validate or evaluate the media. And we invite you in asking us questions. Thank you.